to say I was so excited about this because I was like, yes, this is what needs to happen, especially because so often people say, no, there is all these guidelines and, it's hard to get hormones and it's hard to get surgeries. I'm sitting over here having gone through the process way back in 2014 going, it was easy as cake in 2014. I can only imagine how much easier it's become. Give us the basic rundown on why you decided to do this, what you did.
So, I had concerns about gender medicine from the time my daughter was 14 and we were at a pediatrician visit for just a wellness visit. She was experiencing dizziness. And when the doctor overheard my ex-husband using male pronouns, she was excited and asked in front of us, can I change the record? And I'm glad I was there. But she mentioned to my daughter, you might want to go to the Kaiser Proud Clinic. She said it's a one-stop shop where you can meet with social workers, endocrinologists, OBGYNs, and they can help you with gender-affirming care.
You actually said it's a one-stop shop?
Yes, that was the term she used. I don't even think she was given aspirin. We just left because she's feeling dizzy. And I called the pediatrician a few days later and I said, how dare you bring up the medicalizing? And I don't know if I even used those terms yet because it's all still new to me. I just was really upset that she would have suggested that she could change pronouns in the records and that she would be offering her a next step. So go forward 4 years. Kaiser then offered my daughter over email a gender expression workshop, haircuts and mannerisms and how to lower her voice, just social transition, but still, that's a big move.
I want to comment on the social transition thing, right? Because they act like social transition's no big deal, right? But the thing is, there is a whole component to social transition that then goes into medical transition. What makes someone stop at social transition? First of all, social transition doesn't work because whether people want to believe it or not, we can tell sex pretty good. So a girl is not going to be able to just cut her hair and start wearing boys' clothes and pass as a boy, or as, well, if they're little, maybe. But once you reach puberty, probably not. So what's the next step? The next step is always going to be medicalization.
Exactly. When they suggested it, I kind of got stuck because of this divorce situation where we did allow my daughter to socially transition in school. The counselors really promoted it and her classmates. And at 13, 14, a girl can look very much like a boy because, wearing your hair kind of shaven and the boy clothing, they don't have any of the secondary sexual characteristics yet, the Adam's apple or the facial hair. So at 13, 14, it's a good time to get these kids into the pipeline, right? Back to the point. So because Kaiser had already been promoting this idea of socially transitioning, changing medical records, sending kids off to see the gender specialist. When I got the invitation to go in for my cervical cancer screening, the invitation said to all individuals with a cervix. And I wrote back to my OBGYN saying, why are you using that term? Who else would have a cervix besides a woman? She said she wanted to be inclusive to the gender fluid community. And at that point, I realized I was upset. And I just wrote back and I said, having given it a little bit more thought, I identify as non-binary. Please change my pronouns, and I would like to be prescribed testosterone. And within 45 minutes, they changed my medical records to show me as non-binary and he, him. Right then, it just started, they said, let's get the ball rolling.
So that was kind of like a catalyst or a tipping point for you when you got that email. You were just like, you know what? What if I did ask for it? Was it kind of like one of those things?
That's exactly what it is. The tipping point where I had become so frustrated, kind of scared because my daughter at that point was 17. She'd be turning 18 in 11 months. I said, this is it. I'm going in. And that's what I did.
Were you thinking of proving something to your daughter, or were you wanting to prove something to the world?
As a mom, her safety is the most important thing in the world to me. Probably in the back of my mind, it was like, if I could just show her father, grandmother, her counselors or other people in this town. But I also just wanted to show the world, right? That's why I picked being non-binary, because it's even more crazy, right? Like, what does it mean to not have a sex and to be non-binary?
What I found really interesting about going the non-binary route is it's such a loose definition. It can mean so many different things. The way I'm looking at it is a good therapist should have if someone's asking something, they should go ahead and talk to them about it, right?
They had a big strike because they know their mental health department is so lacking. I mean, everyone knows Kaiser has the worst mental health providers around. It's not what they're focused on, is giving people mental health treatment. And my God, how much easier it is just give someone a prescription for, a cross-sex hormone than it is to figure out why they don't want to be in their body as it is, right? It's just such an easier way to treat somebody.
Yeah. And I know your specific story and emphasis is on Kaiser, but this runs across all of the healthcare industry. And I think, you being a woman who's in her 50s,
Right.
I mean, first of all, that just seems odd. Like that would be a first red flag. Well, what? You're a
Well,
woman in your 50s?
I would think so too, but it's not. When you say you're going to have top surgery, you get a lot of attention, and
True.
you all of a sudden you need this support system because people are going to have to help you when you're in your recovery, and they're going to have to take you to your surgery that day, and then afterwards you're going to have meals brought to you, and you're going to have to do all this self-care, and then even the appointments, as I'm talking to these different therapists, they're so flattering, and they use my name and chatty, and if I could do anything to help you, call me anytime, and I'm here for you.
Oh God.
And so I just felt like if you were a lonely woman who, not even going through a midlife crisis, but just somebody who felt like nobody cared about you, that this whole medical transitioning is a way you might just get to feel special. One other thing I did too, just to kind of help me get in that mind frame, is I went on to some Facebook of non-binary female to male groups. Every day I'd hear stories about people being misgendered at work, or how am I going to come out to my kids, or and so I just got to hear from these people where they are in their life with wanting to transition. And so I think that kind of gave me an idea that this is not really just teens or young adults. This is actually any age. We got people that are in their 60s and 70s who think transitioning will be the answer to them.
There is a huge like religious cult aspect to this idea that you can change your life and become a different person. I mean, that is very enticing to people, no matter what, but it's especially enticing to people who are depressed and who have, mental health issues.
One of the patients in the top surgery class, she mentioned how before the surgery, she always feels a little bit of stress, but when she comes out of it, she's so elated, or feels like she accomplished so much. And she said, after my top surgery, I had my hysterectomy. But she was in her young 20s, right? And I'm thinking, what's the next surgery? You do your top surgery, your hysterectomy. I'm assuming she's probably will end up pursuing phalloplasty. But I got this feeling of like just doing these surgeries gives you this feeling of accomplishment and of,
Yeah.
of having goals. So
Control. You're in
control.
control. That's a huge component, right? I mean,
Yeah.
my God, you have the whole medical industry doing what you say.
Yeah.
They're also making these people lifelong patients. So, how much aftercare is going to
Yeah.
continue for the rest of their lives?
Yes.
This isn't Star Trek, people. You don't just step into a little room and come out the opposite sex. These are very invasive surgeries that do not have good outcomes. It is constant maintenance and care. There's all that money behind there, too. I actually look at what you did as like something that should have been done a long time ago. This is good journalism. This is investigative journalism. This is what you're supposed to do, right? Let's test the system. Let's test
Right.
it. I was so shocked too that you were able to even get okayed for a phalloplasty. Like even that shocked me. And I feel like I'm hardly shocked anymore, but I was like, wait a minute. She's just saying she's non-binary. She's waffling all over the place. She's not wanting to take testosterone, and they're still going to give her a phalloplasty.
Yes. So the first response is, we can't give you your phalloplasty till you've been on testosterone for 11 months. And I said, I feel like maybe testosterone's not that safe. I don't really need the facial hair anymore. I decided because I'm non-binary. I said, I just want to have flat up here, no breasts, and I want the phallus. I said, so can you give me both at around the same time? And so they said in a very nice little email, we'll go ahead and we'll see if we can make an exception. And then, a few days later, I get this good news. We talked to this multi-specialty team in San Francisco, and they're going to make an exception, and you can have your phalloplasty right away. And they said, the surgeon likes to do phalloplasty, so we will get you in. So
from beginning to end, how long did it take you to get approved for all of these massive surgeries?
200 days, I think, but I didn't really rush it because sometimes I just needed a break, and I'd be like, give me a couple weeks before my next appointment.
Still, it's just,
yeah.
I mean, like,
8 months from like deciding one day over an email to change my gender identity.
Just out of the blue.
Yep.
This woman just,
right.
That right there's a huge red flag.
Right.
It should be.
And also that I have a trans identifying child, right? And I have pushed back hard on some of her appointments. So interesting that there's nothing in my records that show that I've also been very, very concerned about my own child.
You have to say the magic word. The magic word is trans, and then
Yeah.
you get whatever you want.
And also body contouring that was offered to me. So if you have
Yes.
like any like, tummy stuff you want to have done, just say it's gender affirming care.
There's a little part in your essay that I really liked and I think gets right to the point. Despite gender activists and clinicians consistently claiming that obtaining hormones and surgeries is a long and complex process with plenty of safety checks in place, I was in full control at every checkpoint. I was able to self diagnose, determine how strong a dose of testosterone I received, and which surgeries I wanted to pursue, no matter how extreme and no matter how many glaring red flags I purposefully dropped. The medical workers I met repeatedly reminded me that they were not there to act as gatekeepers.
Yep, that's they
That's
even use that word. We don't want to be seen as gatekeepers. They kind of say it in a hushed tone, but like that's how they sort of start the call off. Like don't be nervous. We're just doing this because we have to do this, mental health assessment. But we're not gatekeeping.
medical interventions should be gate kept. That's
Right.
the whole point. Like,